Well, good afternoon, everyone, and thank you all for joining us today. Our webinar today is all about branding that builds business. And my name is Becky Goplin. I'm the marketing manager for Tea Leaf Health and also the past president of WHPRMS. I'm just going to quickly go over a few housekeeping items before introducing our speakers today. First of all, to limit background noise, all attendees will be muted throughout the duration of the presentation. If you wish to ask a question at any time during the discussion today, please send those questions our way through the questions widget of the GoToWebinar control panel. Since all lines will be muted, the best way to ask a question is through the control widget, and we will be holding all questions for the end of the presentation. And once that's complete, I will go ahead and moderate the questions in the chat. Also, if we get some good questions that come through, I might ask those in the moment, depending on the situation. So we are also recording the session today, and we will make that recording available to you as soon as it's loaded on the WHPRMS website and the other associations' websites as well. So presenting with us today, we have Mike Milligan, the president of Legato Healthcare Marketing. Mike has 25 years of experience in healthcare marketing, serving in senior leadership positions for Previa Health and Aurora Healthcare before founding Legato. He's an active advocate for rural health through his involvement in NRHA and leadership positions with national associations such as the Society for Healthcare Strategy and Market Development and the Wisconsin Healthcare Public Relations and Marketing Society, where he has earned the designation of Fellow. Mike is a sought-after national speaker on various rural health topics, including strategic marketing planning, physician relations, building outpatient surgeries, brand building, reputation management, and reducing outmigration. And then also joining us today, we have Erin Frank. She is the PR marketing manager for Horizon Health in Illinois. Erin is actively involved in her ICANN and Ishimper peer groups, as well as other state and national healthcare marketing organizations. In addition to her traditional departmental duties, she's the initial contact for provider recruitment and was instrumental in the formation of Be Well, a local community wellness initiative. Erin also is starting a medical weight loss service in her organization. She participates in the Strategic Development and Innovative Projects Committee, as well as many others. Outside of work, she's active in her community and enjoys family time with her husband and 3 little girls. So with that, I am going to let Mike go ahead and get us started.
Okay, great. Thank you, Becky. Thank you all for joining us. We have a great registration list today, so obviously a topic that is near and dear to our hearts, and that's building business through marketing. Certainly we hear a lot about that in terms of, what does marketing do for us and how can we demonstrate its results and those types of things. One second here, get my, there we go. Sorry about that. So as Becky has said, privileged to be able to co-present with Erin Frank. Erin is one of our clients, and as we look at the progress that we've made together, it really is a true partnership where we've really helped each other grow and learn from each other, and I'll kind of show some examples of that as we go through this presentation. But again, in general, we talk a lot about when we hear things in the marketing world, we talk about branding and what does that mean and what does that impact. And what we're going to talk about is, yes, there's definitely a rebranding effort here that formerly Paris Community Hospital and now Horizon Health has embarked on. But especially in the advent of, really limited budgets and such, we don't always have the luxury of saying, we're just going to do a brand campaign. We've done that, but at the same time, we look at it and say, how can we build volumes? How can we actually show the results? And so we're going to talk about that today. And in full disclosure, just like any kind of results that an organization might have, it's a healthy combination between making strong operational decisions supported by marketing. So fortunately, when it comes to Horizon Health, they have a strong strategic plan and have given us clear direction in terms of where to focus, and have made proper improvements. But that combination, as you can see here on the screen, has resulted in some very significant changes in just 1 year. So let's talk a little bit more about how we got there. So as we look at kind of this theme of building and such, we kind of look at, okay, the foundation. And you look at, if you're building a house or whatever it might be, you have to kind of start with that strong foundation. And so when it comes to your organization, whether or not it's your hospital or a clinic or whatever it might be, aesthetics are great. They make, as we said here, they make a home nice. But you got to have the foundation. You got to have that solid rock. And so what we've talked about here is whether or not it's a sound strategic plan or a sound marketing plan, things that we can build off of. And when we look at brand, oftentimes people think of, well, brand is, a new logo, a new name, potentially, what have you. And yes, that is certainly part of it. But those things are the aesthetics, which we kind of call more of the brand identity. But the brand, as I'm sure you're well aware, is so much deeper than that. The brand is who you are as an organization, what kind of experience do they have with you, and and certainly one of the ways that brand is communicated is through your marketing and your advertising, but certainly that brand is communicated in how you answer the phone, how you treat your patients, all those sort of things, any interaction that people have with your organization. So again, as we look at going beyond those aesthetics and having that foundation, it's about having that right plan. And certainly when we look at a marketing plan, it's, you have a plan, but a plan should also be fluid because you need to change it depending on what's happening or changes that you might have. But as you look at, for instance, a marketing plan, it's also talking about how can we be successful and what is it focused on. So before we get into the details on that a little bit, I want to take a step back and transition over to Erin, have her give you a little bit more information on what was formerly Paris and now is Horizon Health.
Hi guys, thanks for joining us today. The organization that I represent, yes, was formerly called, our DBA was formerly Paris Community Hospital Family Medical Center. All 6 words were used to kind of be our system name. The one clarification I want to make, the stats in here, I noticed on the first slide, it probably jumped off the screen at you as well. It said year-to-date 2018. This presentation was originally formulated for a presentation Mike and I gave in September of this year. So the data that you see in this presentation is through August 2018. I apologize that that's not been updated, but with year end still being kind of fresh, I was unable to pull what I needed from my finance team. So just a clarification as we go through the data points for you. What you see on the next slide, go ahead for me, Mike, please, is what is lovingly called our green egg. This is kind of been the star of our rebranding process. I didn't intend for that to happen. I honestly didn't put much thought into this when I built it, but this kind of serves as a visual representation of what we look to do. Those crosses are our old logo, and the biggest one in the middle represents Paris Community Hospital. At that location, we also have an attached rural health clinic, which was called Family Medical Center. And that is the hub of our organization. It was then and it is today. But at one point in time, that was the extent of our organization. And what people didn't understand was what we were naming. This graphic came into play to really give them a visual. So when I worked with our focus groups, when I worked with our employees, we talked a lot about the fact that we aren't looking to necessarily change the things within the egg. We need to name the egg itself. So when you look at the blue area, that's considered our primary service area. The green area is what we would call our secondary service area. And then the green egg encompasses all of that. So what is the name of the egg? What is the name of the whole? And you can see that having a name with a geographic location in it was pretty troublesome when we were trying to represent the egg as a whole. Again, I didn't think that was going to take on quite like it did, but the green egg is still talked about today. We've actually honed it in, we've updated it, we've tweaked it to make it more geographically accurate, and now it's a really important tool as we make strategic decisions.
And as Erin will talk about later, it actually kind of is the basis for some internal kinds of things to kind of play off of those words and everything in terms of the green egg. So.
Right. So this is just a little bit more breakdown about our organization. I understand there's probably people on this call today who are from rural communities. This will resonate with you a lot. People from larger communities, I still think it's a good story or a good tale. But we are a critical access hospital. And then our clinics, we have Paris Clinic, which is the main clinic, which has family practice, general surgery, and a bunch of specialists. We now actually employ a handful of our own specialists, whereas they used to all be visiting. We also have family practice clinics in Oakland and Chrisman. Senior care is outpatient geriatric psych. And we have 2 Easy Cares, which is our branded convenient care clinics. And then we have an ambulance service that we started a week after the rebrand last year. So formerly we didn't operate our own EMS, and now we do. So why was a rebrand needed? We just felt that Paris Community Hospital / Family Medical Center, getting down to the 4th bullet, was a lot to say. I think all of us in marketing know that you try to limit your words. Most commercials are only 30 seconds long. It was really cumbersome operationally, and that appealed to me to change the name for a long time. I had brought it up on and off for probably 2 years prior to when the process actually started. But what really made me go to bat for it more than anything was our organization has had an evolution within the past few years. And you can trace it back to about the time we got some new senior leadership. And we were really on a trajectory for growth. A lot of growth had occurred, and then we had additional growth that we knew was coming, whether it was physician contracts that had been signed or construction plans that had been started. We knew that there was a lot that had happened and a lot that was yet to come. And so what we were struggling with is still our communities just associating us with an ED and family practice only. So we needed something to help get them through that. As it relates to growth, we also had expanded market share in the surrounding communities. And we had always had a little bit of a problem with the hospital versus the clinic internally. So I work for the clinic, I work for the hospital. Is that a hospital department? Is it a clinic department? And we really wanted to alleviate some of that, kind of get our staff out of those silos. Mm-hmm. And then, yeah, as we talked about, it seemed like the right time with the shift in leadership.
Mm-hmm. Absolutely. So with that background, kind of playing off of this, idea again of the home inspection, you kind of start with that inspection, if you will. And as we look at the branding process and such, but we also kind of combine again branding with overall marketing. And part of when we look at overall marketing, there's so many different things to be thinking about in terms of, it's not just market share, but it's looking, as you all know that are on the line here, it's marketing is so much more than advertising. It's about anything from employee engagement to what is the patient experience, what are the community needs, what's a competitive review. And these are all things, that we studied and acted upon as we developed our marketing plan together. Part of that process is kind of a multi-stage sort of thing, but as Erin and I started, to work together just in terms of the marketing plan overall, that requires a number of different, on-site interviews to kind of assess what our current brand is, what our future brand is, where we want to go with marketing and all of that. But then in addition to that, later in the process, as we talk about the actual branding and the name and all those sort of things, that was a whole series of other internal and external types of interviews where, and Erin will go into more detail on this, but the point is that, I would say very inclusive process. I guess that's probably an understatement, right, Erin? That
from my view, a little bit, yes.
Yeah. And but that's a good thing. But maybe, and we'll share with you possibly some things that we would do differently about that. I mean, not that we wouldn't want it to be inclusive, but maybe a little bit more of streamlining some of the process and things like that. But we'll talk about that in just a moment. So, regarding the marketing plan in itself, and again, these all things relate to one another. But just a few takeaways that I kind of want to talk about as, again, we're looking at branding and how we're building business together. We have a process here that we've worked with Horizon on, and we've kind of talked about the interviews and looking at data and all those things. So I'll kind of go through that. I'll kind of fly past that for now. But under this stage 2 here is obviously a lot of what we're talking about here is the brand development. I'm going to focus in just a second on something called service line prioritization that I just want to make a couple points on. And then, of course, as we get to developing our marketing plan, it's not just, what are we doing, but it's what are we trying to accomplish and what kind of goals are we going to achieve and those types of things. And so that's where you kind of get into maybe developing some tangible results. So, but just, talking about that prioritization a little bit, Erin went through, of course, that this is not only a hospital, but this is a broad organization with many satellites, many different communities, what have you. So this is in many ways like a mini system, and that's one of the things that I think sometimes, again, as Erin said, there's applications to this in rural health and outside of rural health, but I think sometimes that there's a misunderstanding of what rural health is, that it's not just one little small hospital somewhere, but there's a lot of things to be thinking about. So as we look at all the things to be thinking about, this is a tool that Erin helped us refine and develop, and we went through a process to make this unique to them. But we use this for a variety of different uses as well. But just to give you an example, and this is, you can use your own method or whatever, but just to kind of give you an idea of what this chart is all about, is it's just helping you make decisions about what to market, when to market it, what not to market, how much emphasis to give it, because, and I've certainly been in those shoes myself, working for a number of health organizations, is that everybody wants everything. Everybody wants an ad campaign. Everybody wants, it's a limited budget. And so it's really trying to maybe in some ways kind of combine the art and the science of marketing. So what you see here is, and again, your organization would be different, but list of, various service lines down the, and then we look up here and we have different criteria, and we went as far as, weighting those criteria. And then when you weight those criteria, you give them a certain number, and what it ends up then is that you end up in a tier, okay? And if you're in tier 1, that means that like about 60% of your resources should be in that tier 1, 30 in tier 2, and 10 in tier 3. Of course, that's all fluid, but it's an idea of saying, okay, what's going to get the larger emphasis and what isn't? And, oftentimes in those criteria to determine that are going to be anything from, is it profitable? Is there downstream revenue? Is it going to produce community goodwill? Whatever it might be. And that's part of that process that you kind of develop as a team. So with that framework in terms of, having a solid marketing plan and such, and then getting into the brand, I'll have Erin now talk a little bit more specifically about the kinds of research that we did to focus in on our new brand.
So as Mike alluded to, the one thing that would have made this process a little easier is if we knew what we were getting into it and when exactly we were getting into it. I had lots of persuasive conversations with administration to get the ball rolling on this, but I got approvals a little bit at a time. So initially I didn't get an approval for a rebrand. I got the approval to test the waters. So we held 8 to 10 focus groups as outlined below, and we first kind of gauged where we stood. We wanted to talk about the progress that we'd made as an organization. Where do we still need to go? How do people feel about our brand now what's our overall brand equity? The two groups that are left off of here are our physicians, our providers. They're left off of here because they're employed, so they were rolled into our employee groups. At this point in time, we didn't speak to them directly or separately. And then the board of directors. And the board had an incredibly high level of engagement, but not yet. So there were some board members included in our community sessions, but again, speaking to the board specifically and directly came at a later stage.
So just to give you an idea, and again, for the purpose of a webinar, you know, we're kind of just hitting the broad strokes here, but in different sessions that we did, depending on the you know, the stage of the process that we were in, you know, these are some sample questions that we would kind of ask people, and we would really encourage people to state their own opinions, and you know, that was part of the facilitation process, because especially when it's something new like this, people look to others and see what their opinion is going to be, and when we do that, then we don't get what we're looking for. But here's an example. What are 3 words you would define this certain this current character of your hospital today? And if you overheard a patient describing your hospital to a friend, what would they be saying? In your mind, what are the top reasons a patient would choose your hospital over a competitor? Now, I would just say that regardless of whether or not you're doing a new brand campaign or whatever, these are just, and there's lots of others, but these are just questions that you should continually ask. If you're doing, for instance, patient advisory groups in your organization, things like that, these are just, you know, just these kinds of open-ended questions in many ways, just, you know, provide a lot of insight, and they certainly did for us as well. So part of that process, as we look at that, and this was probably used, I would say, Erin, correct me if I'm wrong, we used this tool really more for internal purposes than we did when we did the community groups. This was a kind of just getting, you know, some consensus on, you know, because even, you know, I don't think it was anything dramatic, but you know, you see differences in opinions even at a leadership team. You know, maybe the CEO feels a certain way, but others don't, and it helps to sort of go through this exercise. But so you're talking here about, you know, who's the future Paris. You kind of talk about what your brand is, now what you want it to be, and these are certain attributes where you have people, you know, scale them and rank them, and if anything, it's, you know, where you end up is certainly important, but a lot of times what you learn is the discussions that come through in that process when you really probe a little bit and get people to explain, well, why would you say that the future, you know, Horizon Health is more conservative or more innovative, or what it might be, and a lot of things, you know, come out again in that process. So with that background, again, then it was, okay, now let's go to the name. And, you know, Erin kind of explained some of the reasons already for why we were looking at a new name. And one of the things that, you know, as we look at, okay, what do we need to think about when we come up with a new name? And for us, it was, we wanted something to be modern, but yet, you know, friendly, wanted to be kind of more futuristic. Again, represent the complete region, because the dilemma that you have sometimes is you have brand equity in something called Paris. So that's important, but yet, you know, as most organizations, we're trying to expand beyond, so you have to kind of weigh those two things. Naming hierarchy. So again, you know, we have all these locations. So in the end, what exactly are we going to call each place? How does it fall under the, you know, the umbrella of what's the master name? You know, all those sort of things. And then, you know, is it compatible digitally? Is it easy to roll off the tongue? All those sort of things. You know, those are some of the factors. And so, Erin, you know, we, as we said, we went through a lengthy process. Now, we certainly narrowed this down from 80, but really, originally, when we kind of just made this, you know, expanded this to a lot of different people, we had that large of a name, a number of options, but we certainly did narrow that down.
Yeah, the fact that we had 80 name options doesn't mean that we had 80 name options that were worth considering by any stretch.
Right, exactly.
But the reason why I'm proud of 80 name options is because that speaks to the engagement of our staff and even of our community. So I was just keeping a running list of every idea somebody had, good, bad, otherwise. I had employees stopping me saying, I don't understand why we're struggling naming the organization. It's been made pretty clear that we should be called Green Egg Health. Again, that green egg was resonating for people. I have a physician who still stops me and says, I don't know why we couldn't have gone with my idea for the name. His name was Awesome Medical Center. So, you know, it was just something that people kind of felt highly engaged in, and I appreciated that, and I think that spoke to the efforts that we did so diligently to kind of study and gain insight.
Totally agree. So then as we did get to a process where, okay, now let's try to narrow this down into some kind of a methodology so that's just less subjective. So we had, you know, we had narrowed it down to a number of different names. And then we looked at some of the criteria here again and rank those, and that helped to come up with, help us kind of to narrow down the scope even a little bit more, or narrow down the options a little bit more. So as you can see here, was a name geographical, you know, was it concise, is it innovative? Some of the things that I talked about in an earlier slide. And we did get to a point where we had final approval on Horizon Health. So as we look at, you know, a lot of the criteria that we were looking for, and as it says here, you know, suggest a pioneering spirit. We're also in a agricultural area as well, but we didn't want to focus too much on that either. There's a lot of different things we wanted to talk about in terms of being aspirational and optimistic, but also really reflecting the geography and the heritage, you know, of the community. So with that, you know, as a background, then, okay, we kind of talked before about, you know, that difference between brand and brand identity. So we have the name, but then we need to move to, okay, what's the actual visual look? What's the icon? What's the brand look? And so at that point, you look at anything from the, you know, the logo to the color palette and all of those things, the naming hierarchy. And this is the result of all of those efforts. This is the new brand identity for Horizon Health. And then, so as you have that, so you have those things in place, you have the name, you have the identity, and now it's, okay, how do we, you know, how do we change that brand, evolve that brand? And it's, you know, again, we could probably do a whole webinar just on the details of that, because you could imagine, you know, you look at all the things from, you know, signage to letterhead to what have you, and when and how do you move all of that, and what's the cost of that, and enough to make you dizzy, right, Erin? That's that was a lot to track of, yeah. But anyway, to get to that process, we go to a next stage, which is something that we call brand essence, and this is a document that we created together that is really more for originally just more for internal use to help identify, okay, so we know we've kind of described what our brand is. Now let's put it a little bit more tangible, you know, explanation of that. What does that look like? How are we going to treat our colors? What's our photography? What are our fonts? You know, and so we have that consistency, you know, in our materials and in different things that we present. So, and so I think, you know, with that, Erin, why don't we kind of talk a little bit more now about how we involved some of those audiences a little bit more in coming to this point.
Sure. So we knew that we were going to have to be careful about how we did this. That was really key out of our focus groups is that we did have a decent amount of brand equity in the current organization and in the current brand. So we were trying to figure out how to be new and appeal to people who weren't coming here for their health care, but also be sensitive to retain the patient population that we had, not offend anyone, you know, and so we really broke it down into these separate groups of people, and we really catered to them in the announcements and in the just update of what was going on with our organization. So kind of how it worked at the board level, and ultimately that's how this was done, is everything went through our board of directors. And what we decided to do with them is they first voted on a change. So we kind of brought all the data back from the focus groups and said, here's what we think needs to happen. And I will tell you, the big thing that held up this idea from the 2 years prior when I started it was, well, what's the new name? It's just, there's so much concern over, they really wanted a solution from the get-go. And I said, that's not my job. I mean, it's not up to me to tell you what the new name of our organization is. That's going to have to really be a collective effort, and that's going to take some time. And so we had to kind of bite this off bit by bit. And so the first thing that we did was we got the board approval to change the name. And when we did that, we made public announcement of that. Small town communities, we had been having the focus groups, so people knew something was going on, and we just looked at it as a way to stay in front of the message. So that was the first announcement that we did, was letting people know that the board of directors had decided that there was going to be a branding effort at your local hospital. So we reached out to community leaders. We went around to community organizations and talked to them, kind of put in context what we were looking to do. We put in the mail letters specific to our donors. That was the board of directors was probably most concerned about that particular group of individuals, people who had literally bought into our organization for years and years. And we were very sensitive to not letting them feel kind of left behind through this. Our employees, we were fortunate that we have annual Pride sessions. Our values spell out the acronym PRIDE, and so we go through some like customer service leadership sessions every year, and so it was right, all this was happening right in the midst of those sessions. So we were fortunate that we got to use that platform to actually have conversations with our staff instead of relying on communication tools like, you know, flyers and emails and those kinds of things. Patients too, we did mass mail all our patients. We sent it through our communicator within our EHR platform, and then we also snail mailed letters. Internally, I really wanted buy-in from staff. That was my #1 concern as we did this. And so we used them a lot throughout the process, and then they also got everything introduced to them first. So our first celebration was, again, that green egg that had followed us through this process. Staff could come down to a free breakfast in the cafeteria. It was green eggs and ham. And we gave out logo reveal coffee mugs. So they're those coffee mugs that are black, and then when you pour your coffee in, the new logo reveals. So that was really cool. They could also see the new logo. That was the first time they got to see the new logo. And then we do mobile happy hour around here a lot to celebrate things. So we did a mobile happy hour with notebook distribution that kind of reiterated why we were doing this. And then all staff got their first logo polo from the hospital. We bought those for everyone just to kind of make them feel like they were jumping in with us.
Erin, I think with this mobile happy hour, I think you're going to get some job applications now after this webinar.
Hey, we're hiring, right? That's great. That's great. Yeah, they're not always the same. Sometimes it is kitty cocktails, but other times it's, you know, string cheese or trail mix or whatever. And then the next step after we celebrated was to really educate. So the time frame, to put it in perspective, was staff. The brand reveal for staff was, I want to say in February, maybe right at the beginning of March. And then we had about 60 days. Well, not that much, 30 to 45 days probably before the brand released in April, mid-April. So after we celebrated, then we really educated, and we sent, we kind of staged email communication, not to inundate with too much information at once. We gave them tools that they could use at the registration desk. We developed some scripting and all those kinds of things as we revved up for the launch in April. So here's some of the tools. There's the little notebooks we created. Those cups were actually, we launched in April, and then in May was Hospital Week. So those were Hospital Week gifts. Externally, I really felt strongly that the message had to be super, super simple. And so we ended up deciding on what I call just a definition campaign. We had some 3 to 5 points that we really wanted to get across. One of the things our focus groups brought to light was the concern of people thinking we've been bought, that we've been purchased. And so that hadn't happened. The administration change we had about 5 years ago was a positive one, and the community knew about that. So we wanted to let them know that the administration was the same, the ownership was the same, the staff was the same, but it was more. So we ended up with a basic message of we're the same, just more. So that was phase 1. We ran that through the end of 2018, and we're still, we're just newly launching the second phase. So I think we've got some examples here. You can see it's a definition campaign. And then what does it mean for you? Expanded locations and services, access to providers and technology not traditionally found in rural areas, the same ownership, management, and employees that you know and trust. So I just simply need you to know who we are. That's where our head was really at for the first campaign. Okay, I didn't know if we were playing that or not. Okay.
No, it won't play through the,
Okay,
we can, but you can reference it if you want here, what that was about, Erin, and then we can, if we send out a copy, people can review it and click the link. Yeah,
sure. So the commercial spot was really, really great. And what it was, it used like 5 or so key faces throughout our organization. And we had one script that we all had pieces of, and it was just nothing medical at all, just focusing on the friendly faces that you see within our organization, and kind of some background hospital-ish scenery. It included, of course, our CEO. It included a physician, a nurse practitioner, 2 staff nurses, one from surgery, one from our infusion clinic, and myself. I believe that was the 5 of us.
And we'll go ahead. Oh, sorry. We'll go ahead too, and I'm sure Becky will send out a copy of the presentation, and then you'll be able to link and see that. I just know that it's sometimes playing video over a webinar. It doesn't always work real well. So. Sure.
No, that's fine. It's just, I would encourage you, if you do have interest about this, that commercial really, it's 30 seconds that really does sum up what we did. So watch it if you're interested.
It's really good.
It's really good, yeah. Phase 2 is what we are, like I said, we're just launching now. And so this is, to me, this is kind of, we got to put our money where our mouth is. So we said, we've been saying for the past, 10 months or so, we're the same, just more. We're the same, just more. We're the same, just more. So why? What have we done that we feel merits that we can say that? So what we're doing is we're jumping in and we're defining our mores from the patient's perspective. So our more is that we have our Easy Care clinics. And not only do we have our Easy Care clinics, but one of them just opened 2 weeks ago, actually. So we have more of our Easy Care clinics. But that's just the little scripty part down here. The imagery and the more and less is really meant to be taken from the patient's perspective. So what are you looking for? You're looking for more innings. How do you get that? You get that through our Easy Care clinic. So what happens then is it lands you to kind of the campaign hub on our website. You can watch the TV commercial there, and then you can, you will see the icon for that particular service line that you saw on an online ad or on a billboard or wherever, or you heard a radio commercial for. So for instance, the more control, less cost, that wallet imagery is used across the campaign. So should you react to something you see, you'll end up at this web page. You can find the imagery you saw in market. You can click it, and then obviously it will take you to the applicable page within our website. Just another example. So results, and again, as with the other results at the beginning of the presentation, this was through August 2018, but we have definitely seen an increase in volume pretty much across the board. Family practice there looks a little wonky, but one of the major things there is that these results came at the end of summer when we have, as most places do, tons of physicians on vacation. So that really impacts that family practice number.
Yeah, and I think that was an aggregate too. I think one of the clinics did really well, and one of them, because of the provider being out, was low, so it made it balance. It made it that number. But yes, so yep, sounds good.
Oh, then this is a look at our 2 off-site clinics specifically. The Chrisman Clinic, right before the rebrand, we had done a big marketing push in the Chrisman Clinic. They're our most northerly clinic, and so we had done a campaign to really get them some new patient capture to the north and a little bit to the west even, and that had been working. Actually, since this presentation, we've hired a second provider for that clinic. So there used to be a sole provider there, and now we have 2 providers at that clinic. More data for you there, and then can you tell I'm not the fiscal guru? I didn't have any desire to talk about that, but I think it's important. Right?
Well,
we
covered it up front already, so yeah.
It's important.
I love this story you're going to tell about but well, I won't.
So and I'm not just marketing, right? But PR too.
Right.
So
right.
This is the slide that really kind of pulls at my heartstrings, is just the fact that it worked. I mean, people catch on. One of the operational growths, again, that's near and dear to me personally, is just the request for our organization's involvement in outlying communities. A year prior to the rebrand, we formed a community liaisons committee where we really wanted to focus on making sure we were really involved in communities outside of Paris. And so we had, by the time the rebrand came, we'd been doing that for about 18 months. But when we put a new name on things, it's just lit a fire under everything. I don't know. So since the rebrand, we have actually had 3 different communities ask for a clinic in their town. And some of that's going to work out. Actually, one of them is that clinic we just opened a couple weeks ago, and the other 2, we're still looking at the feasibility of doing that. It doesn't always make sense, but what we have done is we have really, really built rapport with those communities. They've toured our hospital, they've toured the other outlying clinics that we have, and we've really talked about kind of increasing our partnership with those communities, whether or not the clinic pans out for them. So to me, that's a huge testament to what we've done. And then I mentioned earlier that we didn't have an ambulance service prior to April of last year. So we launched the rebrand the 15th of April, and then it was within 2 weeks that we launched our ambulance service. So as we were figuring out how to rebrand organizationally, we were also trying to figure out how to brand an EMS service. So we've had a lot of people comment, the EMS manager herself, if those ambulances had said Paris on them, one of the things the focus groups told us is just how limiting it is to have that one specific town name on that when you're wanting really to care for other people. We didn't get much into it, but one of the major findings from the focus groups was what we called Friday Night Lights syndrome, right? So even though you're only 12 miles down the road from a neighboring community, there are strong senses of pride in these small town communities, and they don't want to see, Chrisman doesn't want to see Paris's name on their clinic, right? They compete in football on Friday night, and they compete in life, right? And so we really wanted to take the geography out of our name, and that has been really beneficial too. As we've branded the Egg Horizon Health, we've also made it a point to brand those clinics with the name of their town specifically. And we had it was a little bit like that before, but we've just really re-emphasized that practice.
Mm-hmm. And didn't you actually, Erin, was it like a nearby mayor or something call you and say, what's going on in Paris, but we want to be part of it or something. Was it, did I get that right? Was it a May?
Yeah, yep. So those 3 communities that have expressed interest in it, actually 2 of them, it was the mayor that just, one of them there, he had an alderman who had a relationship with our CNO, and so they went that route. But the most recent example, it was a cold call to my office and just said, hey, we noticed there's a lot going on down there and we want to be a part of that. So, would you entertain a conversation with our community about bringing a clinic and bringing us better healthcare access? And so, like I said, we're working on the feasibility of that. So we've got a little town forum planned and a couple other things to see if that's going to make sense.
Cool.
Just more results, I guess. Positive employee.
It's more results,
More results. Employees feeling connected. I love this picture. That is Ollie Smith. He's our CEO, driving one of our branded minivans, just in a local parade. So again, with the community involvement, and we know that we consider certain geographic people in our service area, and our goal is just really for those people to identify back, for them to feel like we are their healthcare institution. That's the whole purpose. That's the point of all the community outreach, and not always asking them to come here for our events, but really going to them and integrating ourselves into what's already going on in their communities. So I love that photo.
Great, I do too. So, so just to wrap this up before we take your questions, is just to say that every organization is certainly different, and whether or not you require branding or not, some of the initiatives that we're talking about here, some of the takeaways for me are engagement with a number of different constituents is kind of sort of the overriding message to us, is just getting input and support from a number of different people to really make a solid decision and not to be impulsive about things. And then also just to look and say, okay, as we do branding itself is important, but let's also focus on how we can build business. So, so with that, we'll turn it over to Becky, but if there's any questions that we have, but just before we go to that, I just want to say a quick thank you to Erin for not only allowing us to be part of their success, but for taking the time to share these results with you all today. So Becky, I'll hand it back to you.
Thanks so much, Mike. Can you hear me okay?
Absolutely.
Okay, great. So the first question, I think just ties back to the results, and you may have touched on a little bit of this, but I'll just ask the overarching question. I think this is more for Erin. Now that the name has been out for a few months, what has been the reaction between staff, community, just in general?
Yeah, the reaction's been really positive. It was this summer. Well, it was at the county fair, so we rebranded in April, so this would have been July. And I think I should say at the board level, and really even the administration level, this was not an easy feat, and things weren't always unanimous. I mean, the decision to make the change was not unanimous. The name was not unanimous. And I bumped into one of the board members that had given me kind of a time about things, and rightfully so. I mean, she had concerns that certainly needed to be addressed, and she apologized to me, and she said, "Erin, I want to apologize for all the trouble I gave you about the rebrand." She said, all I hear in the public is positive, and everything looks great, and people are really taking notice to what we can do for them, within our organization. And I thought that was it was a really big deal to me. Of course, I told her that she was crazy for apologizing. She was doing her due diligence as a board member, and I can certainly respect that. But to me, that kind of wraps up how it's been received. Even the people who didn't want it understood the reason for it, and they understood what we were working to accomplish.
Well, that's awesome. That's definitely a testament to your efforts. So great job there overall. The next question, I think really could be answered by both of you. So feel free to fight over this. If there was one thing you would do differently, what would it be?
Well, I can start with that. Go ahead, Erin.
I was just going to say, I'm sure we have the same answer. You can start.
Sure we do. Yeah, I think we got there. I think it was a learning process where, as we started to get into, getting input and that sort of thing, we realized that we probably should have defined our decision-making process a little bit sooner. So then when we kind of just said, oh boy, there's a lot of variables going on here, let's take a pause real quick and let's step back and let's get a consensus from the leadership team in terms of how are we going to make a decision, because what's the final process, because what would happen, which is normal, we would think we would kind of be going down a certain route, and then, as it's just human nature. As you talk to more people, then you get another opinion, and so you might have someone from the senior team that would talk to somebody in the community, and they would be influential in some way, and then maybe they would be opposed to a certain name, and then that would come back, and then all of a sudden, well, maybe we shouldn't look at that name, and like Erin said, you're probably never going to have everybody to agree to something, but it's just establishing more upfront what that decision-making process is.
Yeah, I would agree. The difference is I was breaking down a door at a time. And so I didn't ever stop back and say, what's my path going to be to get to the finish line? I was just concerned with breaking down the next door so that we could get a little further in the process. Basically, what happened is I said, hey, admin, and they were finally like, okay, Erin, you might be right. Go look into it. So I did, and when that process started, we realized, I kept saying, what's my timeline and who ultimately has to decide this? And so it took a little while for us to get the direction we needed from administration to say definitively, it's going to be the board. We actually they put a chairman in place for this project at the board level, who I worked with very closely. But again, that was pretty late into the process. So we did have to circle back and kind of repeat some things for the benefit of the board, which was fine. And it was not overly difficult because we had done the legwork already, but it would have been a little smoother if we could have really had all that ironed out from the get-go.
Got it. And that kind of leads me into the last question that we have here, specifically around getting your admin team engaged. So could you just offer some tips, perhaps, on how to get administration engaged with branding and marketing?
I think that, in my experience, anyway, you're going to have some people who it just sparks their interest, and you're going to have some people who think it's a little fluffy, kind of a cheerleader type role. And for me, what I had to do was I had to figure out how to address each individual on my admin team and how to figure out what I could say to them that was really going to kind of resonate with them and what was really going to kind of get them over the hump, if you will. So I really had to kind of drill down and take an individual approach. And still, at the end of the day, I don't think the people who aren't overly interested in marketing, I didn't change that by any means, but I at least got them comfortable with the initiative on the table enough that they agreed to let it move forward, and they agreed to not really stand in its way. So it may be a community conversation that I brought back to an admin team member, or it may be, hey, I was talking to the provider at the Chrisman Clinic, and she's telling me that she's seen 45 new patients in the last month. That's triple the same month last year. I asked her where the patients are coming from, and she said it's really new areas, places that we kind of consider the fringe of our service area. So I was just, and I am on other matters too when it comes to marketing, just always kind of mining the information that comes across your desk and, passing that on to administration to let them know where you think you can have value or to show them where you feel you have had value.
And I agree with everything you said, and I would just add that whether or not it's branding or anything in marketing, it's helping them understand the why, the business aspect of this. It's okay, so why, in other words, why should they care? So helping, if there's someone who's maybe not as engaged with understanding what branding is, helping them understand that this affects the reputation of the organization, which ultimately affects whether or not people are going to come to our organization, how it relates to the patient experience, all to really, again, every audience is different, but putting kind of more of a financial message to it will help. I've learned, especially at the C-suite level, helps people to really be more engaged in the process.
Okay, great responses to all of the questions. I do believe that is all the time we have for today, but I want to thank you both, Mike and Erin, for generating such an engaging and, I think, thought-provoking discussion. So thank you so much for your time. We appreciate you taking the time to speak with us on behalf of all the organizations. So thank you both so much.
Sounds good.
We will be sending out a brief survey after the session, so please take a moment to fill that out, as your input is always valuable and very much appreciated. So keep an eye out for future webinars with us, and thank you so much for joining today. And if there are any additional questions that you didn't send through today, but something comes up afterwards, feel free to email president@whprms.org, and we can answer questions. So thank you all so much for attending today, and enjoy the rest of your afternoon. Bye.
Okay, you too. Thanks, everybody. Bye.
Thanks.
Bye.
Bye.